Hba1c is not the best measure for diabetic control. Blood sugar variability is more important than Hba1c. There is significant evidence to show the negative effect of blood sugar variability in the development of diabetes complications. The blood sugar variability, or what we can call GV here, can cause the development of microvascular complications. This was initially suggested by the analysis of the Diabetes Control and Complications Trial, or DCCT. It displayed that increased Hba1c explained only 11% of the variation in the risk of retinopathy. That means reasons outside of Hba1c must presumably explain the remaining 89% of diabetic complications. In recent years, GV, or blood sugar variability, has been proposed to be an additional risk factor for complications of diabetes. Growing evidence indicates that significant GV, particularly when accompanied by hypoglycemia, can have a harmful effect not only on the onset and progression of diabetes complications but also in clinical conditions other than diabetes treated in intensive care units. Regarding GV, it is important to note the differences among patients. For simplicity, if we take the three types patients as: Number 1, type 1 diabetes patients. Number 2, insulin-treated type 2 diabetes patients. Number 3, type 2 diabetes patients using dietary therapy and/or oral medications. Recent research using CGM, or continuous glucose monitoring meters, showed a substantial variation in the blood glucose values of children with type 1 diabetes, as well as in adults with excellent Hba1c values. This suggests that in addition to Hba1c, big variations in blood sugar may have a predictive value for the development of complications. Glycemic variability and hypoglycemia. In diabetes with insulin treatment, blood sugar fluctuations matter based on how diverse the disease is, how much insulin the body still makes, and its resistance to insulin. Studies show that high short-term blood sugar variability can lead to small blood vessel issues and damages. Research linked blood sugar variability to eye problems in both major types of diabetes. Another research found a connection between sugar variability and kidney issues or kidney damage. The relation of this issue with heart problems isn't clear, but elderly patients with unstable fasting glucose levels were linked to higher deaths. While we are in the middle of the video, do not forget to hit the like button. See the description and comments for references and abbreviations. We would appreciate your comments. After meals, blood sugar levels might be a better predictor of heart issues than fasting levels. Some studies support this idea, while others argue against it. Acute high sugar levels during a heart attack or in intensive care patients can worsen outcomes for people with or without diabetes. After-meal blood sugar, or postprandial glucose (ppg), is crucial for predicting heart issues and overall death. Since 1997, many studies have shown that even slightly high ppg increases the risk of heart disease. An analysis of 20 studies found a clear link between blood sugar variability and heart risk. While evidence suggests a connection between blood sugar variability and small blood vessel issues, its role in predicting major heart issues is less clear. Still, it's worth considering blood sugar variability as a potential risk for diabetes complications. The hypothesis that the maintenance of close glycemic control is of importance in all of the clinical settings is highlighted by the recent evidence that in individuals with normal glucose tolerance, glycemia is maintained within a narrow range between 68.4 and 138.6 mg per deciliter. Translated into clinical terms, this suggests that maintaining a normal glycemic level is important not only in diabetes but also in clinical contexts in which glycemia tends to increase. However, caution is required in treatment, particularly with insulin, to avoid excessive fluctuations and the risk of hypoglycemia, especially in ICUs. It is advisable to make every effort to maintain stable glycemic values, even above strictly physiological levels. Severe hypoglycemia is strongly associated with the increased risks of a range of adverse clinical outcomes in patients with diabetes. In the DCCT trial, a 10% to 30% incidence of hypoglycemia was observed in the intensive insulin arm group. Hypoglycemia was the primary accompanying complication when the desired glucose target was intensively achieved. The frequency of severe hypoglycemia increases exponentially when lowering blood glucose, and several studies have reported that low GV coincided with decreased occurrence of hypoglycemia. Hba1c is a poor predictor of hypoglycemic episodes because it only considers 8% of the likelihood of severe hypoglycemia. On the contrary, GV can account for an estimated 40% to 50% of future hypoglycemic episodes. In a study by Kilpatrick et al., using datasets of the DCCT, GV was independently predictive of hypoglycemia, similar to the mean blood glucose. They also showed that Hba1c is a poor predictor of hypoglycemic risk, whereas GV is a strong predictor of hypoglycemic episodes. Kim et al. Found that Korean T1 German mark patients with hypoglycemic events had a significantly higher GV index, as calculated from the CGM data. Collectively, patients at risk for hypoglycemia, i.e., those receiving insulin or insulin secret agogs, constitute one category that requires GV monitoring. Glycemic variability as a treatment target. The primary purpose of diabetes treatment is to obtain the most optimal metabolic control to avoid metabolic imbalance related to diabetes itself and the onset of complications. Measuring and recording after-meal glucose is an easy and cheap option, and it should be implemented as part of the management of diabetes. GV is a physiological phenomenon that assumes an even more important dimension in the presence of diabetes. It not only contributes to increasing the mean blood glucose values, but it also to the development of diabetes complications. It appears that GV is poised to become a future target parameter for optimum glycemic control over and above standard glycemic parameters, such as blood glucose and Hba1c. Avoiding both hyperglycemia and hypoglycemia by careful use of SMBG and the availability of new agents to correct hyperglycemia without inducing hypoglycemia is expected to reduce the burden of premature mortality and disabling CV events associated with diabetes mellitus. However, defining GV remains a challenge, primarily due to the difficulty of measuring it and the lack of consensus regarding the most optimal approach for patient management. Do not forget to click the like button. Thanks very much for watching this video. Up above you see 2 videos related to health. It will be more helpful to you and your family. See you in the next video.